There's a population of people I see usually in their 30s or 40s who all of a sudden have a stroke. Strokes are something that are supposed to happen to people who are much older, 70s, 80s, with risk factors if they've been smoking, if they're obese, if they have heart issues, essentially if they have culminated a life of really bad habits that gives them a stroke. But these people in their 30s and 40s usually haven't had any of those risk factors. And in fact, we usually end up testing them for more autoimmune causes. And in my world of hematology, we will often send something called a hypercoagulable panel, where we are essentially trying to see if there is a reason your blood keeps on being coagulable or thick, because a more thickened blood system or a more hypercoagulable blood system is more likely to clot. And sometimes the clots can be in your legs where there's leg pain and you're having trouble walking. Sometimes it can be in your lung where all of a sudden you come into the hospital with shortness of breath. And sometimes it can be in the brain where you have a stroke. And when it happens in the brain, if it's in an area that controls your walking or controls your talking or controls your eating, that could affect all those processes as well. This is why it's so important to know your family history, because if there is someone in your family with that type of condition, you could get screened for that earlier on.